So welcome everybody. It's a pleasure to have you all. It's been quite eventful putting together this panel and really looking forward to a rich conversation today. The topic is how are impact evaluations, systematic reviews, evidence gap maps used and how to enhance their uptake. So, many of us are working in this space and, a question that keeps coming up is we do a lot of interventions and we know whether sometimes we test whether those interventions are working or not, and we like to evaluate those. But in this panel what we're looking at is whether the evidence that we put out there actually has an effect. So in a way we're kind of looking, it's an evaluation of evaluations. And so really looking forward to this question that many of us grapple with is that, we generate evidence, but how do we get it to be used? And we have a really interesting group of people here, very excited to kind of kick off this discussion. So I'm going to start with just a little bit of background on what the three individuals are going to talk about. And then I can give you some housekeeping rules. We actually have limited time, so I'm hoping that everybody kind of sticks to their time. Basically, this panel is aimed at tackling the question of whether, evidence is used for real-world decision-making and how do we get that to happen? How can we kind of enhance the evidence that we produce to make sure that it is used? And also, how do we measure and assess whether the evidence is being used? So we have three presentations. We're actually going to start with Kirthi Rao from 3IE, who will provide examples of evidence uptake and also walk us through an innovative way of measuring whether evidence is actually being used. So, and then second, we'll have Timo Kretschmer, who's stepping in for Jan Kramer from DEval, and he will be talking about more from a donor-focused angle is, how do they make sure that empirical assessments are used to kind of facilitate evidence use, and what are the kind of systems that they put in place over time to ensure that evidence is used. And finally, we'll have Goldman, who, who's done a lot of thinking and work in this space in terms of looking at the impact of impact evaluations. And I will introduce each of them separately. We also have a discussant who we will end with, Mr. Girma Kumbi, and I will introduce him at the end. So I'll just start with Kirthi. Kirthi, welcome. Nice to have you. Kirthi is responsible for monitoring, analyzing, and reporting on the impact of evidence from 3IE funded studies. She also contributes to 3IE's projects to improve tools and processes for strengthening evidence impact. Kirthi has worked in a number of spaces, including she has worked on the Planning Commission in India. And over to Kirthi. Kirthi, you have 12 to 15 minutes, and thank you.
Thanks a lot, Divya. I just want to make sure you're able to see the presentation. Great. So hello, everyone. Thanks to WWGS and DEval for this opportunity. As Divya mentioned, I will be sharing how we at 3IE measure the use of evaluation, of evaluations, reviews, and gap maps, the evidence from these research, from different research products. I'll first talk about what evidence use is for us, outline our typology, and then share one approach that has helped us have more confidence in measuring evidence use, and follow this up with some reflections and examples of evidence use in the real world. To begin with, a quick note on 3IE and who we are and what we do. The International Initiative for Impact Evaluation, 3IE, is a leader in supporting the production, synthesis, and uptake of high-quality evidence on what works in social and economic development. Established in 2008, we provide services and expertise to address the evidence needs of our partners, which include governments, NGOs, foundations, international development and others working in low and middle income countries. We have members that work remotely and offices, team members, and offices in New Delhi and London. We also have extensive regional expertise through our Senior Research Fellows Network, our worldwide member network, and other partners. Really glad to be here, as I said. I think the first thing to look at is what is it that we are measuring, right? As with many concepts, this term evidence use is not particularly easily defined. For us, evidence is used when decision makers consult the best available evidence to inform discussions relating to agenda setting and policy development, as well as decisions relating to policy and implementation. And although evidence here is ideally the most locally applicable, highest quality and relevant learning and insights, ideally reflecting the cumulative learning on an issue. In the context of our measurement, what we mean by evidence is 3I supported research evidence, including from impact evaluations, systematic review, and evidence gap maps, among others. We shorten these to IEs, SRs, and EGMs, so I'll keep lapsing to that short form. We require these to be produced keeping relevance, usability, and quality in mind. So now that we know what we are measuring, the question is, how do we actually measure this? And from the political science literature around decision making in the policy sphere, we know that multiple streams and factors that interact in non-linear and complex ways underlie decision making. So given this, the link between research evidence and decisions is not necessarily predictable or time-bound, while research insights and evidence are much more likely to contribute to decision-making and change if researchers employ effective stakeholder engagement and communication. And this is something that we strongly encourage at 3I. While this is the case, major policy and programming changes usually take much longer than the lifespan of research projects. And the evidence contributes to, rather than being the sole factor driving or even influencing observed changes. So given this complexity, two questions arise. First, how do we identify cases where evidence may have contributed to change? And the second is how can we confirm or verify that evidence informing discussions or decisions actually happen? So the first thing that we need to detect if evidence has been used is some theory or understanding about how evidence is expected to influence decision makers. Our monitoring has thrown up 7 different ways that research evidence is used. We started with evidence use categories and types as identified in the political science and social science literature. We looked at what we were seeing in the research studies that 3I supported, and then built up these 7 categories. And as you can see, these categories don't represent a very rigid framework. They include process categories, conceptual as well as instrumental categories. And it's a typology that's not set in stone. We review the names of the types as well as the definitions from time to time based on what we're observing. The second element for identifying instances of use is processes. I mean, to figure out whether a research product has actually influenced a decision, we need a tip-off. So we do not usually find a decision maker directly saying that they have used end of program or project interviews. However, usually the way we identify potential instances of evidence use is from researchers' initial assessment about how the evidence that they're producing might be used and by whom, as well as from their records of engagement. So these records of engagement sometimes include feedback and quotes from users. Records of engagement could include things like progress reports on communication and engagement plans. These could include, meeting minutes, presentations, online reports. Things that you will keep aside from a project management perspective is also useful from an evidence use measurement perspective. And once we have the we may still need to go ahead and verify potential instances of use. And the reason for this goes back to the complexity of decision making, as well as the lag between when researchers engage and when decisions and discussions actually take place. So coming to how we verify the potential evidence use that we detected, there could be several ways to do this, but one way is contribution tracing, and that's what I would be highlighting in today's presentation. So contribution tracing, we began to use this in 2018 for cases where we did not have an evidence user's clear and kind of self-evident testimony. Typically for closed grants, for grants that had closed some time ago, or research projects that had closed some time ago, we went back and tried to verify the contribution of 3i-supported research. Contribution tracing, as presented by Befani and Stedman-Rice, among others, is a multi-step quali-quant mechanism-based evaluation approach that combines the steps of process tracing with Bayes' theorem, with Bayesian updating, to provide a measure of confidence in whether decision makers actually use the evidence and how it contributed to discussions or decisions. The logic of contribution tracing forces the person, measuring evidence use, to only collect the strongest proof to verify each step of the hypothesized contribution mechanism that connects the evidence with the observed change. So the approach calls for paying attention to context, as well as calls for bringing in trained colleagues who know the research project well as the context in which it was conducted, so that all the whole jury can objectively review the measurement of evidence use or contribution. The important thing to note here is that the percentage confidence measure is not answering, how much a study or a research product contributed. It reflects the confidence we have in the underlying proof showing that the contribution indeed took place. And having a confidence rating for the supporting material, it really helps us, because it gives us a clue about which is the kind of stories that we have confidence in that we can report on. It also informs our monitoring processes. So how do we apply contribution tracing? The first step, once we have the tip-off about potential use of evidence, is to clearly lay out the precise contribution that has been claimed and the actors who are involved. So the claim statement or the contribution claim should be clear about what has happened and who are the actors involved and how. So the statement should basically comprise the causal mechanism in a nutshell. The next step is to list the proof that can support the claim and its underlying mechanism. So for each step in the contribution mechanism, we start listing what we think are critical items of proof. And by proof, I mean statements from stakeholders, news articles, photographs, documents, meeting minutes, emails, and so on. What I mentioned earlier, and in listing only critical items of proof, we're basically applying the process tracing logic to consider which items of proof are absolutely necessary and expected for our contribution claim, which items of proof are sufficient in confirming or confirmatory for our contribution claim, and which items of proof that we initially listed could just be straws in the wind and don't necessarily help to confirm or help to reject our contribution claim. They are just additional information which we don't actually need to go collecting. To take this thinking one step further, for each item in the list of items of proof that we built, we assign sensitivity and uniqueness rates. This helps us weigh the strength of each item of proof. And I know I'm really abridging here, but there isn't enough time. But happy to discuss this further. But what these sensitivity and uniqueness rates are conditional probability rates. And using Bayesian updating, these rates give us a sense of how each item of proof gives us confidence in the overall claim itself. So using this process, we gather critical proof. And if we don't find that critical proof, we are we reject our claim. So once we are able to collect critical items of proof, we hold a trial with a jury of colleagues who know the context or the research project and who can bring in contextual awareness and help reduce subjectivity. So these are the steps that we follow in contribution tracing. So using this process and also verifying instances of evidence use using other methods, we have built up a database of 170 plus evidence use instances from 100 plus studies since 2013. And the bulk of these cases are from impact evaluations, with about 19 from systematic reviews. As you can see, there are many instances which relate to informing the processes of change rather than driving changes or actions such as shutting down a program or scaling it up. In 2021, we launched our evidence impact summaries portal, where we feature 50 studies for which we have the strongest supporting information, 50 around the evidence contributions from those studies. And before we move to some real-world examples of evidence use that we've been able to capture, it might be good to pause and reflect on some of the advantages and limitations of this approach. And an enduring kind of issue or discussion has been around whether and how to measure downstream impact of evidence. That is, the outcomes of evidence-informed decision-making itself on the lives of program participants or program efficiency. And given how decisions are likely to be influenced by so many factors other than evidence, assessing this may be even more difficult and complex. Another challenge that we are grappling with is capturing contributions and uncovering the mechanisms of contribution for public goods, such as evidence gap maps and synthesis, and also for our development evidence portal. How do we unravel the contributions of these beyond their commissioning bodies? So having an advisory group is a starting point, an advisory group which comprises potential users. But as time passes, measuring evidence use does become harder for these public goods. We are also trying to find better ways to count contributions which may not be directly linked to evidence per se. To recap an issue that I mentioned before, our approach does not answer the how much or the extent of contribution questions. The approach also requires a lot of commitment and persistence in following up with evidence users. If we find that the most critical item of proof is testimony from a user, it may really need some time and commitment. Also, we do require supporting information. I mean, of course, it's part of project management, but often it's not available, especially as time passes. However, since evidence use is our North Star, and promoting, we do promote use from the get-go by considering evidence use objectives, engaging with potential users, and trying to document and learn from engagement. That's really key. And adapting contribution tracing to our context has helped us to claim contributions fairly convincingly. So on this note, I'd like to move to some examples of use of evidence in the real world. We have verified the first two instances using contribution tracing. So the first instance relates to an impact of, a mixed methods evaluation project. In 2019, our partners in the Ministry of Gender, Labor and Social Development in Uganda tipped us off about how the mixed methods evaluation project is influencing their flagship, Uganda's flagship youth livelihoods program. And it's basically contributing to a cabinet decision around the program. This interaction prompted a review of all the information that we already had and a search for the details of the cabinet decision to make sure that these were in line with the study findings. We found that evaluation project findings have actually informed changes to the design of the youth livelihoods program, including changes to the budget and the head to which they allocated. Another example, and this time relating to the use of systematic review evidence. Yes.
I'm sorry, we've run out of time, so if you can wrap up really quickly, thanks.
Yes, this is my last slide. So the Gates Foundation actually uses a 3i supported SR in its empowerment model. This model actually guides its investments, supporting the foundation's gender equality strategy. Another example, which we have recently come across, is an instance of informing other programs. Here we received a testimonial from our partner, which is Africa Center for Evaluation, who let us know that they are using our development evidence portal, which is 3i's largest of its kind, largest of its kind portal containing IEs, EGMs, and systematic reviews. They're using the portal as well as the Africa EGM to guide their work with the governments to promote evidence-informed decision-making. So, yeah, I think I'll stop there. In any case, I'm out of time. But over to you, Divya. Sorry.
Great, thank you so much. I'm going to hand over to Timo Kretschmer next. He's currently an evaluator and evidence expert at the German Institute for Development Evaluation, DEval, conducting research on rigorous impact evaluation. Since 2018, the research project records the current state of implementation and evidence take-up at DEval. And he's previously worked at the World Health Organization in Lesotho. Looking forward to hearing from you, Timo. Over to you.
Thank you very much. Let me see. The screen sharing works. It looks good. Okay. Yes, thanks for having me here. So I'm stepping in for my colleague Marion, who unfortunately fell sick today. So just a disclaimer, bear with me if I'm missing something on the slides or I'm slow on something. I work in a research project at DEval, so the German Institute for Development Evaluation, on rigorous impact evaluation and rigorous evidence in German development cooperation. And today I'd just like to share the results from our project, which are really quite fresh. So you're one of the first ones to get this, to get those results. I'm gonna tell you a little bit about the project and its background, and then tell you what methodology we used, and then jump to findings on status quo of evidence take-up in German development cooperation, then the barriers that we identified, and also what our analysis has as implications. So just a little bit of background, so why this project exists and what it entails. So previously, so probably prior to 2018, we did see increasing dynamic in German development cooperation towards measurement of impact, although there does not seem to be universal understanding what impact means in German development cooperation. And previously, there was also no information on the number of rigorous impact evaluations and their take-up in GDC. And since then, so since 2018, the BMZ now financed the research project. And this project, with this project, we aim to find out, first of all, the status quo of RAE, so both conducting RAEs and taking up the results. And today I will only talk about the second part, so taking up the results and not the initiation part. Secondly, what are barriers for the little initiation and take-up that we see? And thirdly, what are measures to really increase the initiation and take-up in a systematic and appropriate way? In terms of methodology, we tried to include different approaches, and we had different primary data sources. So first of all, we conducted around 50 interviews with different stakeholders of different organizations within German development cooperation, but also with evidence experts, international evidence experts from other organizations. Then we conducted a stock-taking survey to really take stock of how many rigorous impact evaluations have actually been conducted in German development cooperation. So this exercise had previously also been done at GIZ, just I think 2 years ago, but just within GIZ. And so we built on that and conducted it for all of German Development Corporation and also again within GIZ and expanded that number. Then we also did an evidence survey, which was quite large and was sent to basically all stakeholders in German Development Corporation that could potentially somehow use evidence. And we got quite a good response of, I think, 1,000 respondents there. And then we also reviewed international experiences with regard to evidence. So to just see how does DEVID do it, what does the World Bank do, and looked at a couple of organizations there. And of course, we also relied on secondary sources such as scientific literature. So let's jump right into our findings. So this is on status quo of evidence products. So the first top 3 rows are basically the knowledge among German development professionals on RAEs, systematic reviews, and evidence gap maps. And moving to the right would mean that people have never heard of those products before. And as you can see, it's not looking that great, especially for evidence gap maps. A bit better for RAEs and systematic reviews, but still not great. And the last bar is the 3E evidence portal, where we see an even larger share of people that have never heard of this before, or at least a tendency towards not using it and not having heard of it. So just in general, knowledge on all 3 products and the, well, let's say main source for those products is quite low among professionals. Then if we talk about evidence take-up, then we in our project, we kind of split it up into 2. Well, because first of all, there's self-generated evidence, right? So if in a project, a development project of German Development Corporation, somebody conducts their own impact evaluation, you could take up this evidence, and also you could consult the global evidence base and look at the 3E evidence portal. So here is just some findings on self-generated evidence, so from own impact evaluations in the own project. We see that lessons from RAEs are often shared with other projects within the organization, within the own organization, but not really systematically. Then in some cases, they are used for designing follow-up projects and adjustments, but also not systematically. Results are sometimes or often used for accountability, but they are not used for strategic decision-making. And we thought we'd give you a first-hand quote on this topic of, I think, follow-up projects. So this is from an interview that we conducted. Look at the strategies. They are full of normative thesis, but they don't somehow say that this has proven itself. There is no empirical foundation for such things. I hardly know of any strategy that says we've had great experiences, they are robust, and that's why we're going to continue. So just to give you this idea of it's not really strategically used when thinking about what to do and what to continue. What about the global evidence base? So here, again, findings are maybe even more striking. The global evidence base is rarely used and very rarely explicitly referenced. And we conducted a document analysis looking at different project documents among GIZ and KfW projects. And in project documents, if claims are being made about impact, then typically this is being done without referencing rigorous evidence. In most cases, without referencing evidence at all, but at least no rigorous evidence for sure. So of course, this little graphic that we included here is not true for every individual or every project. And there are very good examples of how it could be done and good examples of good evidence use, but that's just not the overall picture. We do see a high demand among evidence. So on the left, it's a lot of support for statements such as evidence should be used more, and that it would be helpful if I could use more evidence. So in both questions, we see development professionals do want to use more evidence. So if we look at the barriers, I'm looking at the timer right now, so I'm trying to wrap this up. We try to see what are the barriers, why is evidence just taking up not so much in German development cooperation, and we group the barriers along those steps that you see here, and those are just steps that we identified or simplified steps that we think are necessary towards evidence take-up. I'm just going to walk you through those, starting from the top left button. So there's a low priority of evidence for decision making, and also no formal requirement for take-up of evidence. Then under availability, we have that often the relevance is limited of research questions, so that practitioners can't really use them. And sometimes there's unclear transferability of single studies, so more of an external validity problem. Then in the third step, there's scarce and unsystematic dissemination of findings. And under resources, we have a high staff turnover, so staff change projects a lot or even leave the organization. Then there's unclear responsibility for ensuring take-up of evidence, and especially limited time resources, because using evidence takes time that people don't have. We also have missing knowledge management. Often there's no actionable recommendations in research, so what to do is unclear. And we also have findings are not presented in a very illustrative way. And then last but not least, we don't really see a culture of learning from failure here. And I should probably say that those are just the barriers that we identified as being the most relevant. We identified a whole lot more. So this is just the most relevant excerpt. We then also in our research, we also try to identify potential measures that could tackle those barriers. And I'm not going to walk you through all of those measures, but just to show you what this looked like. So on the left, you see a list of potential measures, and on the right, you see the barriers that I've just presented to you. And what I just want to tell you is different measures, or one measure might actually address barriers, and vice versa. One barrier can be addressed by multiple measures. And the measures that could target it, I'm just going to tell you like the first three, could be building up a network of knowledge brokers, building RAE take-up capacities, or create awareness for evidence take-up. So they're often quite closely related to the barriers. And then my last slide is basically going through or analyzing those linkages that you have just seen between the barriers for evidence take-up and their potential measures. We try to develop a framework that that best targets all of this, right? Like most effectively, and taking into account the relevance of barriers, relevance of measures, and what could be most effective. And we saw that there is no like one silver bullet. So it will not work to just like implement one thing and then German development cooperation is fine and we'll take up the evidence all the time. Instead, it just needs like a range of things that need to be addressed. And so those are 7 implications. One is raise awareness and develop capacity on take-up of rigorous evidence, right? So just awareness building and develop capacity development. Secondly, we need to strengthen knowledge management by establishing a public RAE database. And luckily, so DEval is already on its way to establishing such a RAE database for RAEs that have been conducted in German development cooperation, but there will also be a linkage to the 3IE evidence portal. Third, we think it would be good to install a support structure for knowledge brokering, and this support structure could take tasks such as synthesizing evidence, present findings in innovative and user-friendly formats. If we think about the What Works network, that's something that a lot of those centers already do quite well. And the support structure would also just give general guiding and advice support for evidence take-up. Fourth, we think there should be a formal requirement to take up the best available rigorous evidence. Fifth, additional resources need to be dedicated to the take-up of evidence. We really see this is one of the main points that people don't have the time and resources. Six is identify relevant topics and evidence demands to guide RAE implementation, because if you conduct research and conduct an RAE that does not answer what practitioners need to know, then it will not be taken up and it's not useful. So we need to really identify what are the topics, what are the evidence demands. And then lastly, this is an iterative process or a process that which fits quite nicely with the presentation we've seen before. So we think we need to reflect the status of implementation and success of the implications that we proposed in our research project, to just measure what needs to be done, what can be adjusted, where are we on a good way, and where is more room for improvement. That's it. Thank you very much, and giving back to you.
Great, thank you. I hope that 3 to 5 years down the line, when we all get back together, this plan is kind of in place, and you have evidence on this in terms of whether it works or not. So
let's hope. Thank you.
Moving to Ian, who's actually been looking at exactly this kind of thinking and work for a while. I give you an introduction, but Ian has been working for more than 40 years in this space across 20 countries, across sectors, including rural development, decentralization, sustainable livelihoods, and M&E, evidence-based policymaking. He's also been the head of evaluation and research at DDG in South Africa's Department of Planning, Monitoring and Evaluation, where he led the establishment of South Africa's national evaluation system. Ian has been the commissioner of 3IE since 2012 and is a founder of the Twende Meble African M&E partnership since 2020. He's a board member of the South African M&E Association. And, so clearly he has been thinking about this, looking forward to hearing from Ian, kind of putting a little more structure in terms of, some of this experimentation and these efforts that have been going on for years now. Like, what have we learned over this period? And are we learning more and improving, or are we kind of stuck with these experiments? Over to you, Ian.
Hi, everybody. So good to be with you and to have a chance to present on this is on a particular study that we were funded by the wider the United Nations University to do, looking at the impact evaluation. And the 3 people working on this were actually also all former board members of 3IE too, we must declare. So, and the core question we had was, nearly 15 years after the Centre for Global Development's report, when will we ever learn? are impact evaluation and the syntheses contributing to evidence generation and use? And the report had argued for a collective push to promote this. And what are we going to find at the end of this about use? And so which of these two situations, bemoaning the lack of knowledge or that we've been far better able to productively use of it, has come to pass? And in all, there have been very few studies that systematically assess the effects of impact evaluations. And we used existing databases, particularly 3IEs, but we also spoke to 54 individuals in major funders, commissioners and suppliers of IEs. We did 5 country case studies and to try and promote further discussion on this. So what did we see in terms of the generation of evidence? So you may well have seen this graph showing the numbers of impact evaluations used. In fact, Howard has just updated this, and the trend has apparently continued. But where are those IEs? They're predominantly in health, nutrition, population, in education and social protection, with smaller numbers in other fields. We're still seeing, in terms of impact evaluations, that RCTs being the main approach, an increased focus on evaluability, but also a return to the use of formative and process evaluations, which certainly in my view are at least as important as impact evaluations, and the development of less expensive and quicker methods while seeking to keep the rigor. And in terms of the synthesis products, again, the speeding up, looking at multiple forms of evidence reviews, multi-country impact evaluations of issues, meta-analyses, and the development of these evidence maps or evidence gap maps. And of course, COVID has thrown the need for these and for the timeliness to be even greater. In terms of overall features in terms of production, we see that the numbers of IEs and synthesis products are still very small in relation to total evaluations. And we could see this from the donor side. We could see it from the countries we looked at, like Mexico or Colombia or South Africa. We could also see that the IEs in LMICs are mainly internationally funded, even in middle-income countries like Mexico, and that the international funding has a dangerously narrow base. And as we've seen the way DFID funding has been cut so dramatically recently, this shows the dangers in that, and with Gates being predominant among foundations, that the donor-funded IEs are still predominantly commissioned by donors or specialist intermediaries like 3IE, and are very often still being led by a relatively small number of northern institutions, despite growing local capacity in the south. So what about in terms of use? The first fact we looked at, how to define and assess use, the evidence of use. And I'm not going to go through this, but we looked at largely instrumental use and a number of ways that echo some of what Timo presented. We talked about conceptual and symbolic use, where there was influence, use for policy dialogue, etc., and largely ones where it was largely process use. And in terms of this, we could, there was counterfactual-based evidence on the use of IEs and just a couple of independent evaluations by agencies. But based on what we could find from all sources, we concluded that the largely instrumental covers quite a lot of program-specific use, including some examples of improving follow-on design, but not much on planning and budget processes. And that's an area where we feel much more is needed. But largely conceptual or symbolic use, there's some high-profile examples, but less than perhaps one might have hoped. And largely process, we're seeing quite broad evidence of high interest some anecdotal evidence of IEs ratcheting up the quality and rigor of other types of evaluative work. So what did we find in terms of factors affecting use? And I should just say that the presentation, which will hopefully be shared, has got many more slides than this. I'm just highlighting some of the key slides. In terms of good practice and engaging with policymakers, so we saw examples of responding to policymakers so they're ready to take a central role. We saw early discussion between policymakers and researchers. We saw engaging with policymakers throughout the process. We saw involving other stakeholders. We saw supporting implementation. And we saw examples of capacity building. But as often, this good practice is not yet general practice. And of course, context is king, and in all cases, these interventions need to be context specific. In terms of some of the facilitators, and there's an overlap here with what Timo presented, which will be interesting to explore in the discussion, political will, a high degree of transparency, and also involvement of the parliament, having a government-backed monitoring and evaluation strategy, and ideally with resources, where this is linked to central government functions. For example, in Mexico, the budgetary consideration report contains an assessment of all social development programs and what the implications are of those for the budget. Ensuring buy-in from eventual owners of the study, from the evaluation design stage, being able to explain and discuss differences between different types of evaluation tools, including IEs, developing recommendations in consultation with stakeholders and maximizing knowledge sharing, the quality of the IEs, having local centers of excellence in the production of IEs, and a system for addressing recommendations. And both Mexico and South Africa, for example, have a system of improvement plans. In terms of barriers, the limited awareness of IEs outside the health sector, the time and cost, the availability of baseline data, impact evaluations not being commissioned early enough, the complexities in programs, which means that IEs, which are often based on quite simple treatments, makes this difficult. Some limit to the supply of local evaluators, although recent work by the Africa Centre for Evidence has found that there did seem to be quite a good supply, at least in Africa. And some of the barriers to the use of IE findings, the failure to understand the information stakeholders need when designing the studies, the culture in some countries that makes it difficult to accept the kind of criticisms that always come through from evaluations, and the lack of institutionalization of findings to follow up on evaluation recommendations. So where do we get to in terms of conclusions then? So our overall conclusion is that the progress has been undeniable and IEs are contributing. Some people saw good practice, but it's not yet general practice. And too often this is disconnected from the M&E systems of LMICs themselves. This has probably not been as transformational as hoped by the original When Will We Ever Learn report. And countries are faced with very complex programs and the development of institutions to address these. And some of these deep-seated issues are not readily amenable to standard IE techniques. The pathway to policy influence is seldom straightforward, and interests often inhibit the changes that evidence recommends. And we all know that evidence is only one of the factors that people take in mind. But now is the time to assess the successes and challenges and to up our game, promoting more IE and synthesis, but amongst other tools. And we need to see that impact evaluations within a broader spectrum of evaluation tools and they're not necessarily the best tool to use. The priority in each country depends on context. So thanks very much. I just wanted to say that just to flag this book that we've just produced on using evidence in policy and practice, which draws many other issues about the issues that are affecting use, and particularly draws out issues around knowledge brokering.
Great, thank you very much. I just wanted to note to the speakers that there are questions in the chat. So if you could look at some of them, Timo, for example, there's a question for you that maybe you could take in the chat. And thanks a lot, Ian. I'm hoping that there'll be a lot more questions for you and everyone else in the during the discussion. I would like to now invite Girma Kumbi, I'm sorry if I'm mispronouncing your name, the Chief Evaluation Officer of the African Development Bank Group. Before joining African Development Bank, he worked for the World Bank and the government of Ethiopia, where he developed experience in public finance, donor coordination, monitoring and evaluation, fiscal decentralization, and national income accounting. Girma has actually, we actually didn't have a chance to share with him the presentations in advance. So really looking forward to seeing what you can make of them live.
Good.
Over to you.
Thank you very much, Divya. Really, this is a very interesting panel that is very important for the really current discussion in terms of the use of evaluation in development policy makers. I'd like to thank Kirthi, Timo, and Ian for bringing out really the key issues that are currently featuring in the area of evidence generating as well as use in general. So I think I would like to just make as a discussant the key issues that can be used in this panel just as a discussion point among the participants. I think the first point I would like to make is it's right. We have seen really globally there is low level of evidence, use of evidence as shown by all the panelists here that I think the three IE cases is about 170 cases of uses globally in general, and Ian and Timo also reflected the same kind of finding around that. So I think the key question that maybe we ask ourselves in terms of this, when we say use, again, we will look at on demand side of this, the evidences, what are really the key factors that can stimulate the demand for the evaluation in general, because we have now the supply of evidences globally, but how we can promote that. So I'd like to see if we can really reflect on this in general. So is it from the how we select the topic for the evaluation, particularly in impact evaluation, which require rigorous, and the extent of also the credibility of the methodologies, all those we use, because most of the time impact evaluation we come ex post. In my experience, where I've conducted some of impact evaluation, we are just going exposed after the project completed, so usually it's difficult to construct the real counterfactual to properly estimate the impact. So so my question around there is how we can really enhance those uses. I see it is featured in some of the presentation, but this really is a topic that we have to maybe dwell on in terms of stimulating demand for impact evaluation in general. The second important issue I like to also raise is about the effectiveness of the impact evaluation. Ian is really well presented around that, the very issues that it enlightened me a lot of areas that we should look at it. So it's that's very important. Usually we use evidence when we see the evidence generated or the policy advice that resulted from those evidence are making the change, a real change. That's very important. Kirthi raised that there is a bit time lag, of course, between when the time we generate evidence and when the change happen. But yeah, that's very, very important. It's like a vaccination test overall for me. Like, we would like to see more, more of these things, the evidences generated or the policy advice we provide as a result of the evaluation really lead to the real change. So it's good that in the case of 3i, Kirthi mentioned there are examples of this some evaluations that are influential, making changes. But at the end, we have to see really those programs that we advise really led to development effect at the end. So the third point I would like to raise is presence of really oversight and accountability mechanism in of course in the country where we provide support, as well as of course within our own organization. So that's very important. If those things does not exist, so it's the use of evidence usually emanates from that, where there is, we like to see accountabilities in certain areas, and the learning is equally important, of course. How far, with whether it's international development or within the country we are supporting, there is an appetite for learning in order to enhance this the use. So we have to make sure that the infrastructure, particularly in our MN infrastructure, should be in place in our regional member country or in the countries we are supporting, where we can really enhance those things, including the parliaments, the line ministry and central ministry, who are looking to learn from those evidence and change something in the next one. So for the fourth point I would like to make is, of course, the evaluation process, how we can develop ownership, particularly when we are doing with countries this our impact evaluation. That's very important case that we should probably discuss. And the last point I would like to make is about how it's related to ownership, but how we internalize the need for impact evaluation or other evaluation within the countries themselves, instead of usually it's like sometimes donor driven and so on, because it's in the presentation I have seen that there's more donor dominant kind of evaluation which is done. So we have to make sure at the end, since we want to make change in the ground, where in the countries where we support, it's important to see how we can ensure that. Thank you very much, Diva. These are the points I would like to. Diva, you are muted.
Sorry. Thank you so much. I was saying if the audience have more questions, it would be great to get them. We don't have too much time, but I do want to say that we will, as Ian said, make available a lot of the presentations. And Ramona, it'd be great to hear how we do that. Can we attach them here potentially, so that everybody can have a look at them? And I would like to kind of just give back to the panel to answer, if you have any responses to Girma's questions and reflections. Basically, my takeaway is that, there's a lot of innovation taking place in terms of evidence use and evaluation of evidence use. And really, I think, what would be interesting is to kind of understand the different kinds of evidence that are required. And I thought Ian's typology was really useful in terms of, the instrumental use, the process use, the conceptual use, and kind of understanding who uses each of these and how do you make each of these kinds of evidence pieces, most kind of relevant and contextualized for different audiences. So it would be good to hear if, you've been thinking about that. The other topic that I think it would be good to just kind of wrap up with is, the sense of, Ian touched quite a lot about it, is capacity, right? Like, who's commissioning some of these, and does it help to kind of go more local in terms of the commissioning of some of these kinds of evidence products? So, and then to Kirthi and Timo, I did have a question also in terms of, just how do you set up to be evaluated better when you are already, creating these evidence products? How do you evaluate the evaluation products better, and basically hold ourselves accountable better as we produce these products? Really interested to kind of see the presentation, especially Timo, the solutions slide that you had. I think it'll be great to have that available. But I think 1 minute of reflection from each of you, and then we can wrap up. In the meantime, it would be great if you could also look at the chat and answer questions. Let's start reverse order this time, from Ian, and then Timo, and then Kirthi.
So I want to just, I just quickly, in response to the question, I just wanted to quickly just show a slide, because I think this issue about culture is really, really important. And we did some research in fact, we've done it in 6 countries, but this shows it from South Africa, been in Uganda. And this shows the problem of culture. And this point about accountability, that we have to move beyond accountability to learning. And if we just take this last row here, 40% of managers in South Africa said that problems were not seen as an opportunity for learning and improvement. Now, when we're in that sort of situation, it's very difficult to learn from evaluations. So and that links to Girma's point. How do we internalize the need for impact evaluation and evaluation? That's really critical. And we've got to move away from this donor commissioned, externally done, northern institutions driven evaluations to evaluations which are at the minimum done in partnership with local governments, which northern institutions should be providing supporting roles. They should not be the leads in most cases. And then we're much more likely to see evaluations which are locally accepted, which are locally demanded, and which are locally used. And one point about use, Kirthi, one of our findings, not specifically in this study, but in just generally, is that, and in the research we did for the book, is that the other types of use are just as important as instrumental use. We tend to fix on instrumental use. The evaluation says, do this, and did you do it? But actually process use, where you start asking questions about how the program is operating right at the beginning of the evaluation, is often just as important as when the report comes out 18 months or 2 years later. Thanks.
Timo, over to you.
Thank you, Divya. So I think your question had like 2 components, right? Like how to come up, how to set up better evidence products that can then better be used, and how to evaluate if they work. I will focus on the first part of that question. So how to really come up with better evidence products. So I think we can build on what is already known, and one part is definitely a closer coordination between those that produce the evidence and those that should use it or that should take it up, so practitioners. And so just that evidence becomes more relevant, and therefore it's already a better evidence product. But then also in terms of illustrating it nicely, we can, I think the most important part is probably simplify. simplify as much as possible, and I think good tools already exist. So I'm just like now from the top of my head, I would say look at the What Works Center for Homelessness Impact in the UK. They have a great evidence tool that breaks down evidence in a very usable format, and I think we just need to think about maybe new formats, simplified formats, well illustrated products that people, that may also be fun to use, and that people have the time to use. And just build on what's there, develop new formats. I think that's cut this short.
Sounds good. Kirthi?
Thanks, Divya. And I think I would completely agree with what Ian said. We do absolutely value process use, and in fact, the indicators. I mean, I don't have time to go into the definitions, but they also look at whether it's informing discussions and the process leading up to action. However, it's like there is a trade-off, because the more you go into process changes, you're relying more and more on, in some ways, testimonials, which are harder to kind of support with documentation sometimes. However, coming to your question about how do we set ourselves up to be more, to first of all promote use and also be more accountable. I think I would completely agree with what Timo said, and only to add that in terms of what's worked well has been to have, within the research team or within the organization, have a set of people who could be playing that dual role of thinking about usability and use from the beginning, when a research project is initiated, and even in conversations with the commissioners to try and see what kind of potential use are we looking at, and how does the research project have to be set up. So sometimes it's been as simple as considering, what is the study cycle going to look like? Is the date at which we are closing the project the same date that our communication has to stop, or can we build in additional time for these products which are focused on making the evidence that's coming out of that research project more usable, more accessible? So it could be within the research team, or it could be like a strategic kind of set of individuals in the organization who do this kind of thinking. Another way in which we have kind of tried to bring in processes that help us be more accountable for use is considering this question of usability in like regular check-ins during the project life cycle. And I think that these have been two structural things that I could think of when it comes to improving our accountability to evidence use. And I'll stop there unless there's a follow-up.
Great, thank you. We've run out of time, but I'd really like to thank the panelists and discussant. Very valuable, and as always, it's we never have enough time to go deep into some of this, but hopefully it's given you all food for thought, and also kind of helped think more about these topics that all of us are thinking about all the time. Please do look out for the resources. I think all these institutions, and individuals have material on the web, etc., that you could use. And also, I think you can continue sharing questions in this format. So thanks a lot. And we'll be in touch 5 years from now to see where, how we're progressing, and hopefully it's positive, more positive and transformative. Thank you. Bye.
Thanks for having us. Bye-bye.
Thank you. Looking forward to it. Bye.